Is there a way to measure endothelial dysfunction? And I believe there are studies out there that with enhancing nitric oxide production, you can potentially even reverse or prevent the progression of disease.
That's right.
But how do we actually measure it? Is there a way you can measure it? Of course, as a physician, you always look at something that's measurable and you can adjust, you can titrate and give appropriate doses and see how much of an improvement that could potentially produce. Is there a measurement for this?
There is, but it's not like your standard blood labs where you can just pull peripheral blood and look at a number like cholesterol or vitamin D or things like that. Because nitric oxide is a gas. Once it's produced, it's gone in less than a second. And we can measure nitric oxide metabolites in the research environment, but there's really no standardized clinical test for measuring blood. So what we have to rely on are, number one, symptoms, but there are now some FDA-cleared medical devices that can actually measure the functional capacity of the endothelium to produce nitric oxide. And this is old technology. It's the original kind of concept is called venous occlusion plethysmography. So in the original type of technology, you could occlude the blood flow into the brachial artery. So you basically just put a blood pressure cuff on the upper arm and you inflate it to suprasystolic levels and basically prevent the inflow of blood through the brachial artery for 5 minutes. And then after 5 minutes, you're creating global ischemia in the forearm. And then you through an ultrasound probe or through a fingertip probe, once you release the cuff, if the endothelium makes sufficient nitric oxide, you'll get what's called reactive hyperemia. You'll get immediate vasodilation when you release the cuff. And so the degree of vasodilation or the reactive hyperemia correlates with the amount, what we call endothelial function, or the endothelial's ability to produce nitric oxide. And so you can measure that through ultrasound and the degree of vasodilation. There's some devices out there that have a fingertip probe that measure the degree of return of normal temperature to the fingertip, which is directly correlated with how much blood flow and how efficiently you're getting blood flow from the reactive hyperemia, which is dependent upon the blood vessel's ability to produce nitric oxide. So there's venous occlusion plethysmography. There's non-ischemic plethysmography devices now that look at really mainly the structure and function of the blood vessels. How soft and compliant are the blood vessels, or how stiff and rigid are the blood vessels? And these are very important and instructive devices on give people the kind of the sense of how good is their vascular health. Because what we've discovered is that the functional loss of nitric oxide in the lining of the blood vessel precedes the structural changes or plaque deposition and even the stiffening of arteries by many years, sometimes decades. So if you can tell in your patients early on that they're developing a degree of endothelial dysfunction and then employ strategies to reverse that, then you don't have to deal with plaque deposition, atherosclerosis, cardiovascular disease, heart attack, and stroke. Because not only does nitric oxide prevent the onset and progression of cardiovascular disease, it can actually reverse it. And if you've got some vulnerable plaque, nitric oxide can actually stabilize existing plaque and prevent plaque rupture and heart attack and stroke.
If people want to improve without medication, without anything else, their daily habits, what can they potentially do to enhance this naturally?
Yeah, no, it's a great question, and we always start with diet and lifestyle. And the science of nitric oxide is extremely complex and complicated, but the solutions are really quite simple and straightforward, and it's basic common sense that we've known for decades, if not centuries. So I tell people you only have to do two things to restore nitric oxide production. Stop doing the things that disrupt it and start doing the things that have been clinically shown to promote it. And so we can tackle those one by one. So what's inhibiting or disrupting nitric oxide production? Mouthwash use, we published on this 10 years ago. If you use mouthwash, you destroy the oral microbiome. It destroys nitric oxide production and your blood pressure goes up. And you lose the protective benefits of exercise. If you're using mouthwash, you have to stop. There's a reason that physicians don't put patients on antibiotics every day for the rest of their life because of the known health consequences of destroying the microbiome. So why would you use an oral antiseptic every day for the rest of your life? And yet 200 million Americans wake up every morning and use mouthwash. And not coincidentally, 200 million Americans have an unsafe elevation in blood pressure, which, by the way, is the number one risk factor for the number one killer of men and women worldwide. So if you're using mouthwash, you have to stop. The second problem is fluoride. Fluoride is an antiseptic. It kills your thyroid function, and it's a neurotoxin. and yet fluoride's in toothpaste, fluoride's in municipal water supply. So we have to remove ourselves from fluoride. Use a fluoride-free toothpaste, get a home filtration system, remove the fluoride that's in your drinking water and the water you cook in and the water you bathe in. And then the other major problem is use of antacids, specifically proton pump inhibitors. And these drugs, as you're probably aware, were never approved by the FDA to be taken chronically, only for acute.
Do you know how many patients are on proton pump inhibitors?
Well, the data are, there's 200 million prescriptions written every year, and that's not even counting the over-the-counter purchases. And these are very dangerous drugs leading to increased heart attack, stroke, and Alzheimer's.
Of course, I work in the hospital. So a patient gets put on a proton pump inhibitor and it sticks, it stays there, and it just stays on the patient's medication list. So that ends up happening. And a lot of times you have to tell the patient, okay, so it's not just for your stomach that it may cause long-term problems, but for example, you eat food, you need to have acid to actually digest it. And so many diseases that need to be eliminated by the stomach acid. So you can't have zero acid. And these proton pump inhibitors, they can actually get your acid level down to almost zero. And in the long term, you can also develop dementia. Diabetes has been linked with it. Aspiration pneumonia is a hugely linked with proton pump inhibitors. So if you are on proton pump inhibitors, and just a public message, I don't want you to stop at cold turkey. I want you to talk to your doctor and ask them that if there's something you need to, put a hold on or test it out, how you can do without it. So definitely, I think that's going to be part of us understanding down the line how all of these things are integrated and combined.
I've never understood as a biochemist and physiologist why clinicians would put people on antacids and proton pump inhibitors and keep them on. So, it's not, now we have a clear understanding that it's completely inhibiting nitric oxide production from both pathways. It leads to an accumulation of a molecule called asymmetric dimethyl L-arginine, which inhibits nitric oxide production and lining the blood vessels. It prevents the nitric oxide formation from the dietary, from swallowing our own saliva and getting aversive nitric oxide. And that's what's causing the increased heart attacks. So data published in 2015 revealed that people who had been on PPIs for 3 to 5 years had a 35% higher incidence of heart attack and stroke because of the disruption of nitric oxide production. And then just a couple of months ago, it was revealed that people who had been on PPIs for 4 years, at least 4 years, had a 40% greater incidence of Alzheimer's and vascular dementia. So those are just the consequences that can be related to loss of nitric oxide production. But you mentioned it briefly. Without stomach acid, you can't break down proteins into amino acids. So you become deficient in certain amino acids, and a lot of these amino acids are neurotransmitters, develop neurological disease. You need stomach acid to absorb nutrients like iron, magnesium, selenium, chromium, iodine. And so then we become nutrient deficient if we don't have stomach acid. And most, if not all, chronic diseases are associated with some nutrient deficiency. And so we have to restore stomach acid production, not just to restore nitric oxide production, but to really increase metabolism and the breakdown and the production of energy from the foods we eat. So these are very bad drugs, and I believe they should have a black box warning on them, just like the Vioxx and Celebrex did back in the early 2000s, because they're causing increased incidence of heart attack, stroke, and Alzheimer's. And consumers need to be warned. Patients need to be warned of this.
Yeah, definitely. If you have, ulcers, okay, there may be a reason for it. But of course, get yourself checked by the doctor that, okay, do I still need to keep on with this? And if you want to clean up your diet, that is causing you to have acidity in the stomach, that you need some medication for suppress your acidity, you can improve your diet, eat clean as much as possible, avoid spicy, oily food as much as possible. So you can potentially work on it. Thanks for watching, and I appreciate you as a valuable viewer. And if you liked this segment, you can watch all of the different individual segments or the whole podcast to have a broader understanding on this topic. Just check the links in the description or what you see on the screen right now. I'm Dr. Umer Khan. Looking forward to seeing you again. Thank you.